I am I'm Monica Young. I'm the host of the GREI Club. And today we're going to co-host an event with the Wellness Forum. And may I introduce to you Ms. Barbara Wong, who is going to be the moderator for the event. Hi, Barbara. Please have the floor.
Thank you, Monica. Hi, good morning, everyone. We are a group of Wellness Forum. In our group, we have healthcare professionals, and we want to share the wellness information and practices to you so that we can live more happily in a wholesome and productive life. In particular, these days, with all the pandemic and the chaos that we are experiencing right now, we are seeing lots of emotional and physical stress. So today, we want to have our speakers to provide you more insights and experience in managing them. We have 3 speakers today. Nicole Chen is a licensed, certified clinical social worker for over 20 years. She is also currently actively involved in the outpatient practice work in Chinatown of LA. The next speaker, Jenny Kwong, is a dietitian and certified diabetes educator. And she is working at Palo Alto Medical Foundation, which a lot of you are very familiar with in the Bay Area. Carrie Fu has been a pharmacist for over 10 plus years, and she has been also teaching healthcare and medical classes while pursuing her passion in wellness. Without further ado, let's talk about what are we going to cover today. First of all, we will talk about what are the signs, symptoms, and signals of stress so that we can be more aware of it. But afterwards, then, do I have it? How do I do assessment on it? That's the self-assessment that we're going to touch on. Then, knowing some of those symptoms or assessment results, whether we have it or not, then how do we prevent from having it? And more importantly, how do we take care of ourselves? Last but not least, after sharing the summary, we will have open forum for all of us to share questions and answers. Without further ado, let's start on the first topic. And then I will have Nicole to start on the psychological part first. Nicole?
Good morning, everybody. I'm Nicole Chen. I'm from Los Angeles. I want you to go back to a time when you lost an item. Maybe a set of keys, your cell phone, or maybe you lost in your investment. Do you remember how you felt? With that one loss, how did you feel? And now, as we're, oops, geez. Oh, no problem.
Go ahead, do it.
Okay. Okay. So can you hear me?
We can hear you, Nicole.
Okay. I clicked something by mistake. Okay. So you remember how it felt. And that was one loss that you experienced. And it might have caused you to lose sleep, to not eat, to a lot of other issues that came up. What we're dealing with is actually a sense of loss, not just one. It's multiple losses. It's compounded during this pandemic. Loss of there's a lot of uncertainty that's going on. Some people lost jobs and then gradually lost their home, became homeless. And we lost that wonderful sense of like, okay, autonomy, that we can do things whenever we want to. But now we even have to think it over if we are going to go for the dental cleaning. Or I have friends and clients who told me that their surgery or their cancer treatment got delayed. That's quite scary. And then the second type of loss is the loss of normalcy. In the past, we take things for granted that we will go eat any restaurant we like. We will celebrate holidays, weddings, anniversaries. We go on vacations. But because of this, we no longer can do that. We're kind of locked down in a very, very difficult mode. Let's get back to the last slide. So our normalcy is gone. And then we also have to face the fact that social distancing is actually social isolation. For those of us, especially some of us that live by themselves, this is scary. And for children who used to study with other classmates that have that human contact, that dynamic, that social interaction, these are all gone. And then
Nicole, you are mute.
Yeah.
okay, so when we talk about social isolation, there are people who cannot say goodbye to their loved ones, and that's very, very sad, and that's also very stressful. And on top of that, we're constantly getting bad news. There's still no cure for this pandemic. And then just a day ago, our president also got the disease. So on top of that, there's going to be changes. There's going to be and then on top, we have the wildfires, we have the earthquake, we also have a lot of social unrest. So thinking about having all these compounded losses, we may not be aware that we are under a lot of stress. And aside from this, we're also having to learn new roles. We're taking on new challenges. Next slide. Adopting new lifestyle. Let me ask you, if your boss came in and said to you one day, saying that so-and-so, I need you to do these extra jobs, these extra tasks, but you will not get compensated. And then you're not particularly trained in those areas. What do you think? How may you feel? That's exactly what we're experiencing right now. We got thrusted into new roles. Many parents, they became teachers because they have to teach their children at home. And some family members, they became the caregivers because in the past, they could have hired caregivers to take care of their loved ones. And sometimes parents also turn into coaches, or some people who never cook. Now they have to learn how to cook. So a lot of new roles that got thrusted to us, and we have no say-so. How may you feel? Do you like these new roles? And then another role that sometimes we don't really want is that we become extremely hyper vigilant. Not only on the supplies for cleaning. In the beginning of the pandemic, people fought over tissue paper. And now we became extremely conscious. The other day, I went to a dim sum restaurant and I walked too close to someone, and then you could see that look at me, that stare at me. That was like, oh, gee, I was in trouble. So because of all these differences, we are being put into a new normalcy of life. We have to wait in line to get into grocery stores. We have to clean ourselves, sanitize ourselves after going out to get groceries. And whenever we get packages, we have to sanitize really carefully. So we're all thrusted into this new lifestyle. And we have to learn how to not go to the gym and exercise, or no exercise at all. Think about the pounds that you have gained since the pandemic. Think about, all these compounded stress and how is it going to affect our body. And then I'm going to pass to Carrie.
Thank you, Nicole. Next slide, please, Barbara. Good morning, everyone. So from Nicole, we really learned and recapped on what are some of the psychological effects we're facing during the pandemic. What I would like to spend some time talking about is our physiological reaction to stress. So the three modes that we typically react to stress is fight. So when I mention the word COVID-19 or SARS-CoV-2, what would be your reaction? Would you take on the role of, wow, I'm going to do all I can to fight this virus? Or would you do the second mode, which is flight? You're running away, so you're pretty much not listening to any news. You just want to be by yourself. You don't want to listen to anything. And lastly, it would be freeze. So freeze would be kind of the phrase deer in the headlights. Some of you may have heard of that. Is that we just basically, when we face stress, we just freeze and we don't do anything about it. Next slide, please, Barbara. Thank you. So what happens when stress, what would it happen to our body when we face stress? For our body, typically when we see a lion running toward us, or a dog, or if we face work, or we face a pandemic, there's an activation of your sympathetic nervous system in addition to your endocrine system. So if we're talking about the sympathetic system, think about it. When I mentioned the word COVID-19, pretty much you may notice your pupils are dilated. This is because you're preparing for events and you want to see better. Your muscles tend to be very tense, and you may have fast breathing. You may have fast heart rate. Your bladder can relax. You decrease stomach and intestinal, so some people may be constipated. And your liver actually kicks in and start breaking down what's called glycogen. These are chains of glucose. And because your body needs the glucose to prepare for fight, flight, or freeze. And lastly, your adrenal gland. This is a gland that's sitting on top of your kidneys. It actually secretes two types of hormones. Adrenaline, all of you have heard of it, right? When we had the fight or flight, that's our hormone, adrenaline, or epinephrine is another word. And long-term wise is cortisol. So Jenny is actually going to talk about the effect of cortisol and stress eating
today. Well, as a dietitian, I see a lot of people struggle with weight gain during this time. You probably heard about freshman 15. Well, there's a new term called quarantine 15 to describe the current situation. I also observe a surge in new cases of diabetes. And a lot of people who had diabetes maybe for years, and during the last 3 months, the last 3 or 4 months, that they found out, they went for their blood test and they found out that their A1C have jumped to the diabetic range. It's some is pretty serious, and they're like the A1Cs in the even 12 or 10, and maybe just in a pre-diabetic range like 6.2 a few months ago, and so that not only because of diet, but as Nicole and Carrie mentioned earlier, because we're so stressed out during this time and our cortisol go up, and it can also affect our blood sugar as well. So on a side note, so those of you who know that you have prediabetes and you have not had a blood sugar test this year, it might be a good time to do it right now. Okay, well, I can tell you that there are definitely some common themes in dietary changes when people stay home a lot. First of all, we see there's a lack of routine, and people are not eating on a schedule when they're out of their regular routine. So what happened, you know how it goes, right? You work from home, you will get up whenever you feel like it, and then you may skip breakfast, and you know, you may work through the lunchtime and end up eating very late. Okay, and when you're very hungry, well, what happened when you eat when you're very hungry? Yeah, you will overeat. Okay, however, there are those who snack and graze all day long. Okay, they eat not necessarily they're hungry, but because they're bored, or they get stressed out, or food is just around. So this is what we call the mindless eating. So before shelter in place, we have other outlets. We hang out with friends, we go shopping, we go to the beach, and now we do everything from home and everything on Zoom, and we wouldn't have to celebrate special occasions online. How many of you been to a Zoom wedding lately? I've been to 3 just this summer, and I have one coming up tomorrow. And so we really miss out a lot. We feel like we really miss out a lot, and we're not connected with each other. And so a lot of time when we get have this sense of frustration or loss or boring, we turn to food as a quick fix. Now, I don't want to feel totally it's your responsibility, because you see, this is a behavior that we learn as we're growing up as a child. Remember, you used to get candies when you answer the question right in the class, or your families always go to dim sum or pizza on the weekends, and there's always cake and sweets whenever there's a celebrations. So we always just tend to associate certain foods with happiness and joy and reward. And so when we go through a situation where like we are bored and we get stressed out, and these are not really fun for us, and so we will turn to food to help alleviating the monotony of our boredom, or we try to escape from our stressful reality. So in terms of physiologies, eating promotes the release of 2 happy hormones, namely the dopamine and the endorphins. And they make us feel good and rewarded. So if you don't set up your environment right and not mindful about this, mindless eating will happen almost on autopilot. We also tend to eat the wrong food during this time. People are going out to the grocery store less often. They only go when they have to. Okay, so there might not be a lot of fresh food around, and they end up eating a lot of convenient food and processed food, because these are the non-perishable that we stocked up, and they are usually or mostly they are carbs, such as the ramen, the instant noodle, the ramen, the macaroni and cheese. And they are high in fat or high in sugar and salt. These processed foods do not fill us up, do not nourish our body, and they only increase our craving and have us come back for more of them. And as a result, we end up gaining weight, and our blood sugar, blood pressure, blood cholesterol all go to the wrong direction. Okay, Barbara?
Yeah, so I think all of you have heard about all these different areas of stress. So if that's the case, then how do we know whether we have it or not, right? So the next slide we are going to talk about is how do we assess it? And I would like to have Nicole to share more on that. Nicole?
Okay, so before I go into the assessment about mood or whatnot, there's a concept that is extremely important for all of us to know, okay? This is about psychosomatic. I remember when I was 8 or 9 years old or even younger, every so often my parents, they will argue, they had heated arguments, and then afterwards, I would see my mother lying on bed, looking really sick. And then she would tell me she had this severe headache. She was very weak. And in my young heart, I was wondering, is she going to die? And then I was very fearful. I don't know what to do. So I became extremely nice and well-behaved. And then other times, yeah, after my mom slept for a day or two, then she would perk up and then she became very active again and then getting things done. So I was kind of like, gee, you know, if she's sick, she should see a doctor. So I always have this question in mind. I doubt, you know, is she going to live long? So anyway, not until I was in graduate school, or maybe actually in graduate school, it came to me, it dawned on me. What she is expressing is what we call the psychosomatic symptoms. She has a physical symptom, her headache. It's real, it's not fake. But then the root of her headache is not because of an illness. It's not because of an infection or injury. Let me put it another way. Not because of any kind of physical injury, but it's really about emotional injury. That injury caused her body, as what Carrie mentioned about our nervous system. So she developed headache. Headache. With that said, I don't mean that everybody who has headache is psychosomatic. All right, no. You do have to get the right kind of treatment to assess and then find out. But what I'm focusing on is the kind of headache that's psychosomatic based. That means, you know, if you don't know the root cause, you can't treat it effectively. There are examples like people, they will feel this shortness of breath and then pounding heart, and they're so afraid. They thought, okay, I'm having a heart attack. I'm gonna die. And so they rush to the emergency room. Well, 2 hours, 3 hours later, they got sent out. And then they follow up with blood test or heart test or whatever, and found, I was told that, okay, so probably you have a panic attack. Again, the sensation, the physical sensation is very, very true, very, very real, but it's not medically based. So the medical doctor will not be able to treat you. And usually, or sometimes they will tell you, okay, go find a counselor, go find a shrink. All right, so this is very important. And the symptom may be headache, back pain, or stomach. When you have stomach problem, frequently it's related to stress, because stomach is what we call the second emotional center. The first emotion center is in our brain. So for people who keep getting help for their stomach problem by medicine, maybe it's time to think about maybe this is actually psychology or emotion related. So with that said, okay, again, I'm not saying that you don't need to get treatment. You do need to get treatment, but you need to go to the right place to get the right kind of treatment. So with that said, let me let's talk about taking a mood assessment. As I said earlier, when we have that hiccup, we all feel differently. Now, this is what's important. Name the emotions. When something happens, let's say you're driving, okay? You're driving in the correct manner. Another car came by, on your side, so close, right away. What do you feel? What kind of emotions do you feel? Lucy, I'm gonna call out names. Lucy Yuan. When the car drive too close to you, what do you think? All right, so I guess, I'll answer for you. Okay, so Lucy, thank you. Lucy, how may you feel?
I'm nervous.
Nervous. Okay, so if I asked you, of course, you have to use some of your memory, okay? So put yourself into that situation. How nervous were you on a scale of 0 to 10? 10 being none and 0 being none and 10 being extreme.
Also depends the car how close to me.
Right. So, it could go on, what's the worst? If you are using your imagination, I hope you never get to that point, okay? But just think about it.
Like 7 or 8.
Yeah. And then with that level of your anxiety, what do you notice about your body, your breathing, your heartbeats, your muscle tone? Will you still be relaxed or you'll be holding onto your steering wheel really tight? Do you notice any ache, pain?
So if, just nervous, just that moment, it's you hold your, the wheel so tight. If not dangerous, totally release it.
Right. So some people, they may have reaction, gut reaction. We have the term gut reaction. It's actually very real, very true. How do you feel in your gut? And then, so I use that as an example because I think a lot of us can relate to. And let's now look at some of the questionnaires that the mental health professionals frequently used. Now, this is PHQ-4, Patient Health Questionnaire 4. It's actually a combination of 2 questionnaires, which are the PHQ-9 and the GAD-7, okay? GAD stands for Generalized Anxiety Disorder, okay? So the first 2 questions are from the GAD-7, and the 3rd and 4th questions are from the PHQ-9. So they combine these 4 key questions to help people understand where they are in terms of their mood. So over the last 2 weeks, how often have you been bothered by the following problems? Your choices are not at all, several days, more than half the days, or nearly every day. So the first question is feeling nervous, anxious, or on edge. So you can do your own score. And the second question is not being able to stop or control worrying. Now, if these 2 questions, you have a combined score of 3 or over, that would be a signal for you to pay attention. And then the 3rd question, little interest or pleasure in doing things. And feeling down, question number 4, feeling down, depressed, or hopeless. Again, these 2 questions, if the combined score is 3 and over, then there is suggestion about maybe you're experiencing depression. Now, I want you to think about this. Now, these questionnaire, when I'm doing my clinical work, when I'm meeting with clients, sometimes, they have an impression that they have to, check it so to show nothing instead of reflecting the true picture. Well, if you go to the doctor runs some blood tests. There's the score. The blood test, the purpose of the blood test is to reflect your true situation. So also blood pressure too, okay, that is a reflection of where you are. And it's extremely important that we get the true picture so that, can troubleshoot. However, at times, when we're still dealing with emotional health or mental health, we kind of like shy away from it. Like, no, not really. I'm not depressed. I don't think so. We all sometimes struggle with that. We don't want to admit to this is an issue. So don't do that, because you may lose out the golden opportunity to get help. Actually, depression, anxiety, these are all very treatable disease. And then, however, the longer you wait, then, the longer it will take for you to get healed. So I hope these information is important, are relevant to you and are useful to you. And for your information, I also put down there's these screen PHQ-9, GD7 screeners and translations. They actually have Chinese version and other language versions too. They are downloadable from this website. You can see it on this slide. And Barbara? Barbara, you have to unmute yourself.
Barb, you're muted.
Hello, can you hear me now? Yeah.
Yes, I
So-
can hear you. Hello?
Yes. So let me go back to the slides here. So with this, then let's look into how do we prevent and take care of ourselves. The first area, as you know, is something that we can easily do it on ourselves, is our eating habit. With that, I would like to have Jenny to share some of her information with us. Jenny?
Right. So one of the questions often people ask me these days is, what should I eat to boost my immune system? Well, first of all, I want to clarify that there's no magic food or pill out there that would fix your immune system right away. Okay, think about your immune system is a very complicated system, and there's no amount of kale juice or turmeric pills that could actually boost it up right away. But what we can do is to support our immune system. There are certain key nutrients that are important for that. And here are some of the practical ways we can do to help getting these nutrients into our body to support our immune system. Okay, first of all, we see that the very important thing is to eat the real food and avoid convenient and processed food. You know, those processed food and the sweet, they actually suppress our immune system. And so we want to make sure that this is not in our regular diet. So no matter how much, you know, how much good food you eat, if you're also eating a lot of these processed food, you know, along with that, and you're really kind of defeating the purpose. So eat real food and avoid sweet and processed food. Then I'm going to show you a way how to eat that, so that you know that you're healthy, you're eating healthy food, you're eating balanced diet, and but most of all, best of all, you don't have to count calories. So let's introduce. Let me introduce the plate method. One thing you notice in the plate method here, this is first of all it's 9 to 10 inches plate, not a huge like 13 inches big dinner plate. This is a medium size 9 to 10 inches plate. So you limited the portion there already. Okay, and then you will notice that it's all real fruits. Okay, and then there are 50% of on that plate is vegetables. All right, and when I talk about vegetables, it's not just vegetables. You notice that have different colors and different kind of vegetables in there. You know, as far as a vegetable is concerned, the more colorful, the more variety, the better. Okay, you see these colorful vegetables contain a lot of phytonutrients and antioxidants to keep us to fight diseases and help us to stay younger, help us to stay healthy. All right, and so that's the vegetables. The next we need to look at is the protein. You see, that's about a quarter of that plate is the protein. So we're looking at about 3 ounces of meat a meal. So we're looking at the size of my palm, not my whole hand, but my palm, which is about 3 ounces of meat, like half a chicken breast, or the size of my cell phone. You know, if you have fish or steak, and that should be adequate. And most people probably need anywhere between 5 to 8 ounces of protein a day. Now, including enough protein in our diet is important. Okay, now this protein should be lean protein like egg and poultry, fish, and tofu. Occasionally, maybe once or twice a week, we can include some red meat as well if you like. And these proteins are important to help us to build and repair our body tissues and help us to fight viral and bacteria infections. The last but not least in the plate is the carbs. Now, I think recently the carbs really get a lot of bad names, and the low carb diet and the keto diet is very popular nowadays. But including some good carb, such as beans, whole grain, like brown rice and oats, and also some starchy vegetables such as sweet potatoes are in our diet is important because not only that they provide us with tons of nutrients, you know, to support our immune system, and it has a lot of good fiber there, but also it helps our brain to make serotonin, which is a key hormones to help to stabilize our mood, our feeling of well-being and happiness. So if you already feeling a little bit edgy and anxious and maybe depressed, eating a low-carb diet may not be the best thing for you. And also you see that a lot of the you know, in that healthy plate, we see a lot of fibers. You get the fiber from the vegetable. We also get the fiber from the whole grains. Fiber is important to support our immune system. A big part of our immune system actually insists on our gut. And so supporting our gut health with good nutrition and fiber is vital to the well-being of our immunity. You know those dietary fiber that found in fruits and vegetables and whole grains and beans, they're actually food for our good bacteria. And when we have a balance for the gut bacteria, that actually help our guts to function better, and also help to us to have a robust immune system. And so that's why fiber is not just for for relieving constipation, but there's a lot of things that with fiber that there's a lot of health benefit that we might not aware of. There's also including lower lower our cholesterol. It can also help us to feel this satiation sooner, so we're not need to eat. We're helping us to curb our craving. So a lot of benefit of eating fibers. So if you follow the play of the play method and eating a variety of fresh whole food, you are likely to going to be hitting a lot of these immune supporting nutrients, which includes zinc, selenium, protein, vitamin C, vitamin D. That is good for your immune health. I just want to share that, if you have not been going outside, stuck all day, try to go out, once a day during the daytime for 10-15 minutes. Get some sunlight. That's the best source of vitamin D. And also, I love eating dry mushroom which is not only high in vitamin D, but also had a lot of antioxidants that help us to strengthen our immune system as well. So let's move on to address the issue of mindless eating. So a picture worth 1,000 words. And many of you, or well, at least I do, can relate to this slides. Okay, and so how do we deal with mindless eating? Can we have the next slide, please? So my number one recommendation is to establish a routine if you kind of lost it during this time. Reestablish a routine. When you eat three meals at a regular time, and you have a regular schedule of snack if you need to, it is crucial to break the cycle of mindless eating. Another strategies I like to use is what I call the front-loading eating, which means that you eat more and earlier during the day. Start your day with a healthy, well-balanced, and substantial breakfast, including protein, then followed by subsequent lighter lunch and dinner. A balanced diet with good protein and fats and high fiber carbohydrates and a well balanced with a lot of green and leafy vegetables. It's going to help you to reduce the risk of mindless eating, because you're satisfied, your body is nourished, and you're more able to say no to the temptation of these junk food. Because you're physically, you can tell yourself, I'm physically not hungry for it. Now, I also like to always help my patient to do this, to help themselves to pause and think when they have an urge to reach out for food or snack. And so I always tell them to just pause and think. Am I hungry? Just take a few seconds to just pause and ask your question, and maybe have some deep breathing. Okay, would easily kind of break that momentum of mindlessness, and help you to get back to what you should be doing, what you should be thinking. All right. And sometimes I would also ask them to post a note, like on the door of the cupboard and remind themselves, drink some water first. So this is another tactic to help the person to think, to pause and think again, so they would not keep going this mindlessness. All right, and so so it helps. All right, and now I think one of the most the easiest thing to do is to just kind of make sure that that you don't have food around that is so accessible. Now, many of us now work from home, okay, and some of you may even set up your workstation in the kitchen. But if you're having a jar of cookies and bowls of nuts and bags of potato chips on the counter, and it's going to be hard to resist. So stack them away in the cupboard, put them on the the top shelf, and out of sight, out of mind. And better yet, don't buy them in the first place. So do not go grocery shopping when you're hungry. Now, with that said, I'm not saying that we need to be totally abstain from eating, these so-called forbidden food that we enjoy and give us, bring us good memories. But instead, we can acknowledge that we're indeed going through a difficult time, and this is a very unusual time, and we need to acknowledge that feeling, and it's natural for us to turn to food, and but we can be compassionate, have more compassion and understanding for our feeling and for our feelings. So it's okay, it's okay to allow ourselves to eat this, forbidden food once a while. But I think the most important thing to remember is that, first of all, we need to have a routine and a structure in our lives, so that, and then we fill ourselves with nutritious food as a foundation. And so if we like to eat some, of these, the food that we enjoy, then we can do that from time to time. We can allow ourselves maybe do it once a week or a couple times a week, and we could really just enjoy it, and without feeling guilty and without at risk of mindless eating or overeating. So lastly, okay, don't forget about social contact. Now, most of you probably, stay home with have more time to stay with your family. I want you to make use of those time. Make use of those time to eat together and to share, time together. And try to have dinner maybe, a few times a week together, sitting around the table. And if you live alone, you can maybe arrange some lunch and Zoom lunch and dinner with the loved ones, or even somebody across across the country in the East Coast, and just sing the time together and just enjoy a meal together. So stay in contact with each other. And I think that's not only for our physical health, but our mental health as well. I think Nicole would probably would agree with this, and so let's hear what she had to say.
Thank you, Jenny. You mentioned about eating with other people, because that's really important in terms of taking care of ourselves in connecting, having those opportunities. So from a psychotherapist's point of view, safeguarding your and my emotions is the key thing. So everything starts from knowledge. Having the correct knowledge is essential. So one of the knowledge that I would like you to take home with is that accepting emotions, pleasant or unpleasant, is just human nature. There's no need to suppress, deny, nor ignore. Unfortunately, this is not really done. Think about a 5-year-old child. If he happens to be a male, a boy, and he fell, likely you feel hurts, and then the natural response will be crying. And guess what the adults around him may say? Instead of acknowledging, helping him, they may say, hey, stop crying, you're a boy. What is the lesson to this boy? Is when something bothers him, when he hurts, he better shut up. To ignore, to deny, because it's not manly. Now, I'm sure, you can relate to a lot of these situations, including ourselves. We frequently tell us, no, don't, yeah, I'm not angry. I'm not angry. I am not angry. I've seen in my therapy office, I've seen a lot of people, I would say all of them came because they lack, or they are not having the best way to manage their emotions. Again, we cannot control what's going to happen. We don't know, we're not prepared for, whatever situation that comes to us, we cannot prepare, but we can prepare ourselves on how to cope with that. So I would also like to introduce to you a very effective and common practice in psychotherapy is to use the cognitive behavioral approach, CBT in short. CBT has a variety of tools and strategies to help people. So one of the things I would like to talk about here is the ability to identify trigger, such as let's say the trigger will be someone gave you a durian, that tropical fruit. Okay, so what kind of thought pattern? And then the emotional and behavioral responses. So let's practice, okay? So let's say Jenny and Barbara, Nicole gave you this top grade durian, very fancy, very expensive. What may be your feelings? What may be your immediate feelings, Barbara?
I can't wait to get it because I love it.
Okay, so you love it, okay? So you can't wait to get it. It's more like a thought. But what is your emotion? Happy, sad?
I'm happy and I want to eat something that I have longed for that I don't always get.
So your emotional response is you're happy. And your behavioral response will be?
I want to get it.
Okay. Maybe you also thank me.
Oh, for sure.
Okay.
Can you take this away? I need to be talking.
I'm sorry. Okay, so you enjoy my gift. What about Jenny? I sent you the same high grade durian. What may be your emotional response?
I feel disgusted.
And then your behavioral response?
I want to throw it away. I want to get away from it as far as possible.
Okay.
Sorry, Nicole.
I'm so glad I didn't give you an
Yeah, don't give me.
She can give it to me.
Yeah, I can give it. But you have the part. I'll probably put it in the front yard. You to pick it up yourself.
Okay.
You're not going to be in my. It's not going to be in my house.
Sure. Okay, so the key here is that durian is actually neutral but then it can trigger very opposite emotions. And then, of course, behavioral responses. Why? Because each of you have a different set of thoughts about durian. So Barbara, what thought do you associate with durian?
Happiness, enjoyment.
Enjoyment. And then for Jenny?
I feel because it smells so bad. It kind of remind me of like rotten things.
See? So our thought pattern is the key to how we respond emotionally and also behaviorally. So the key using CBT, one of the tools is to, sometimes maybe you're carrying irrational belief or self-sabotaging belief that definitely will trigger unpleasant outcome. How many of you have been driven in traffic? Okay, raise your hand. Okay, those who stop your video, I will just take your hand too, okay? All right, so we all have driven in traffic. What may be your immediate emotional response? Happy, joy, frustration, irritation, you name it. Most of us will fall to those so-called unpleasant emotion. And then what kind of a behavior response? What may be the emotional response? I mean, what may be the behavioral response? Can Billy answer me? Billy, can you unmute yourself and answer me? What kind of behavior may you have when you drive in traffic or you've observed other people may have? Okay, so Billy is not responding, so I will answer for Billy. Okay, likely you'll be very, you'll be impatient. You are maybe blaming, how come, it's delaying my thing, I'm gonna run late, blah, 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 okay? Or some people, worse, they become very, very dangerous in their driving. Why? What are these people thinking about that will have this kind of outcome? Because this traffic is killing me, okay? This traffic is taking up my time. But if you keep thinking like this, that's the outcome. You can predict the outcome. See, it happens to me for many years that I drove 4 days a week to downtown Los Angeles to work, and I struggle with traffic every day. And I found myself really like, and then I was carrying a very bad, vibe to work. That's not good. So I started examining what kind of belief, and I used CBT on myself to learn that, oh, gee, I'm thinking about, this is taking up my time. So instead of thinking like that, I change it into something else. I start to think about, wow, I have 45 minutes of uninterrupted time in an enclosed space, safe space, all by myself. I'm free to do anything. With that shift, my emotional response becomes grateful, happy. And my behavioral response is, I'm gonna use that time to enjoy my private concert, to plan for my presentation, to plan for my vacation. So the whole outcome is different. And then I also want to talk about the I statement. Frequently we got stuck. We're angry. We stay in the anger too long, not good. So the key of I statement is to redirect the unpleasant emotion, channeling the energy to a positive space. So I'll give you an example, okay? I feel worried when my friend has been in the hospital for too long. I would like to, okay, instead of staying in my anxiety mode or worried mode, I would like to say a few prayers for him. So this way, I'm no longer wasting my energy worrying. I'm directing it. Or maybe I would like to take a few deep breaths, or maybe I would like to write him a card. So there are all sorts of things that we can channel these worry or anxiety or whatnot into. So with that said, I think it's time for all of us to practice some really important techniques that Carrie is going to teach us.
Thank you, Nicole. So I really want to thank everybody for paying attention and staying engaged. Barbara, next slide, please. No. in the interest of time, we are at 11:06 or 11:08. We do want to save some time for you to ask questions. So I'm going to wrap this up in 5 minutes. What Nicole and Jenny really talked about are techniques that we could apply to our life. And this is my take-home message for you, is that deep breathing can actually ease anxiety. Dr. Paul MacLean actually talked about we actually have one mind, but guess what? 3 brains. So the 3 brains that we're talking about is down here. I don't know if you could see my mouse, probably not. Down at the very bottom, our brain is actually kind of like onions. Down the very bottom is our reptilian brain. That's our survival brain. And this is when you regulate your, your urge to eat, to, your heart rate, your breathing rate. The next layer is actually our mammalian brain, which is our emotional brain. And then lastly, the outer layer is actually our neocortex, which is our new brain or our rational brain. So very often when we stress eat or when we're, anxious, it's actually the reptilian brain that's active. So what we're going to provide you are techniques that you could activate your outer layer or your rational brain, where then the attention is taken away from that, oh my God, I'm not safe, I'm scared. But focus on, yes, you are actually safe and you're well at this moment. So deep breathing can actually ease anxiety because it is part of this parasympathetic system, which counters kind of the Chinese yin and yang. Is the parasympathetic system relaxes, and you have the sympathetic system, which is the stress activation, which is the fight, flight, or freeze. Next slide, please, Barbara. Barb, next slide.
Wait, because of my mouse, yeah.
Okay, thank you. So I would love for everybody to participate with me. I can't see your camera, but feel free to turn it on if you like. What this is called the mindful breathing, and you could also practice incorporate the mindful breathing as part of your meditation. Now, as a pharmacist, I've seen patients take anxiolytic, but I think instead of taking medication, because Chinese has a saying that medication is actually 30% poisonous. So instead of taking medication, you could actually use this to activate your parasympathetic system. So if you could breathe in through your nose, like this, but breathe out through your mouth. So look at the cow, he's breathing in through his nose, but the deer is breathing out through his or her mouth. And this is a 4, 6, 8 count. Now there are many different variations. I've heard of 6, 7, 8, 4, 7, 8. So there are many different variations to this. What I really like is even numbers, 4, 6, 8. So if you could practice with me, you're gonna breathe in on 4 counts. So that's all start. Breathe in, 1, 2, 3, 4. You're gonna hold your breath for 6 counts. So this is a Chinese 6, or you could do this. So hold it, 1, 2, 3, 4, 5, 6. Now, some of us can't hold it that long, just go ahead and breathe out. And the count of 8. 1, 2, 3, 4, 5, 6, 7, 8. So that's practice again. Let's do it for 2 cycles. So breathe in. 1, 2, 3, 4. Hold it for 6. 1, 2, 3, 4, 5, 6. And then let it out on 8 count. 1, 2, 3, 4, 5, 6. All right, one more time. 1, 2, 3, 4. Breathe in. Hold it for 6. 1, 2, or as long as you can. 6. And then let it out on 8 count. 1, 2, 3, 4, 5, 6, 7, 8. I hope you feel a lot more relaxed now. Next slide, please, Barb. So in summary, as Nicole mentioned, our brain is full of thoughts. Our thoughts will lead to our feelings. So if you're anxious, guess what? Your heart rate increases. You have shortness of breath. You may feel like you're having a heart attack, even though it is a panic attack. I've had patients who said they're the same. The panic attack is actually very, very much similar to a heart attack. It's just chest pain, harder breathing. So our thoughts and our feeling really dictates our behavior. So really utilize the techniques that Nicole mentioned is to identify the trigger, know that it is okay to feel that way, and then think, are you safe? Yes, we are. We are safe and everything is going to be okay. And I always love to play the song. Sometimes playing songs will help relax you too. All right. And I do want to talk about how to deal with anxiety in summarizing what Nicole, Jenny, and we mentioned. Proper nutrition is very, very important. We have a circadian rhythm. So Nicole mentioned to have 3 meals on time, not just eat whenever you want or grazing. So have, breakfast at 9 or 8 or 7, lunch at 12 or 1, and then dinner around 5 to 7. Don't eat too late, all right? Time management, that's also part of your discipline. It's a habit that you need to focus on. So wake up early, go to bed early. Please don't go to bed after 11 to 12, yeah. Because in Chinese medicine, at 11 o'clock, this is where your liver is most active. So make sure you try to go to bed before 11. Jenny and Nicole both mentioned about sometimes we feel social isolation. So make sure you have Zoom, right? Call your friends so you can eat together and really focus on the positive thinking. And Jenny also mentioned about exercises. Please get some sunshine because sunshine could actually convert could help you convert vitamin D, which is very important in mood regulation. A lot of us are not getting enough sunshine and we have depression. So make sure you are getting some sunshine for 20 minutes. And then also daily exercise will actually activate your endorphin, which is similar to morphine, which will help you with pain management. Lastly, new hobby. So thank you all for coming to the class because this is really to obtain the correct knowledge like Nicole mentioned and actually use it to improve our behavior. So thank you very much. I will turn it to Barbara. Barbara will open questions and answer. Thank you, Barb.